Okay, this one you're going to find interesting. A tweet from former U.S. Surgeon General Jerome Adams is going viral this morning, really highlighting the sky-high costs of health care in America, even for the country's top doctor. After being treated for dehydration during a recent emergency room visit, Dr. Adams says he was charged $5,000, and that's after his insurance was kicked in. Now he's advocating for change, calling the healthcare system financially crippling for many Americans. So joining us now is Dr. Jerome Adams himself, former U.S. Surgeon General. Dr. Adams, thanks for being with me this morning. You received that nearly $5,000 bill after a visit where you received 3 IV bags and some blood work. Your first thoughts when you got hit with that astronomical bill?
Well, my first thought was, oh my gosh, this is why 100 million Americans are in medical debt, why medical debt is the leading cause of bankruptcy. And, it wasn't complaining for my own sake. I will be okay. But most Americans would literally be crippled, as you mentioned earlier, by a bill like this.
Yeah, I think we all have our own personal stories, right, of opening that envelope, you get the bill and thinking, this cannot be right. I mean, I just had an annual skincare check and was charged nearly $800 for it. I couldn't believe it. From the healthcare world, what's the reasoning for charging patients an arm and a leg?
Well, you're right. The cost is just too high. The $5,000 I was charged was literally for about $500 worth of services. I could go around my neighborhood right now and get labs, IV fluids, and an EKG for less than $500 a la carte. That's number one. Number two, we're cost shifting. Insurers and healthcare systems are saying that they're charging people like you and me more to make up for the folks who don't have coverage or can't pay. That's a problem with the system. But ultimately, it comes down to transparency. People need to know what they're going to be charged. You wouldn't go to a hotel room and they just say, hey, well, we'll tell you in 4 to 6 weeks how much this is going to cost. Arbitration, we need to have a fair process for people to be able to dispute charges. And we need provider accountability because they hold a gun to your head. They literally say, if you don't pay these bills, we're going to turn you over to collections. We're going to ruin your credit.
And then you have a moment like this, right? And you say to yourself, well, no wonder people go undiagnosed. Most Americans can't come forward just out of curiosity to get a blood panel done. Or, they're not going to come forward if they don't have anything that's glaringly wrong. I mean, what's your biggest concern? Is it that most people aren't going to come forward and get the treatment they need?
Well, my biggest concern is, again, that this is the leading cause of bankruptcy, which then leads to emotional and mental health issues when you feel like you can't pay your bills. But as you mentioned, people are foregoing care. They're delaying care. This is a problem that I brought up during the pandemic. We had to highlight that people could come in and get free care for COVID because people were literally saying, I'm not going to come in until I literally can't breathe because I'm worried about a unexpected and surprise medical bill.
Yeah, people can't afford it. I'm curious, what's been the reaction to your post? I mean, how are people responding to a former U.S. Surgeon General showing that even he can't get affordable health care and has a problem with it?
Well, we've had millions of impressions on my tweet about this, more than what I ever expected. But as you mentioned, it hit a nerve with people. It resonated. And when you see someone who is as sophisticated as I am in terms of the healthcare system, you're not going to be more educated in terms of how to navigate the healthcare system, who actually is in the upper income levels. And even I am having difficulty navigating this. The average American doesn't stand a chance. And so I hope I hope legislators and regulators are hearing this, and I hope they will take some meaningful action to provide, again, that transparency, that education, and to address those costs that are just completely out of control for the average U.S. consumer.
And just about 30 seconds left. You bring up Congress. I'm curious, we're in the middle of a big election year. Why isn't this issue getting more play on a national stage?
Well, it's not getting more play because there are too many people out there who are profiting from this. Healthcare is 20% of our GDP. Some people say that as a bad thing, but that means 20% of our U.S. is relying on this system that is broken. So we need more people speaking out, and that's why I put that tweet out there, and it's why I'm speaking out today.
Yeah, well, Dr. Jerome Adams, we saw the tweet ourselves right here at NewsNation and had to have you on for your insights. Thank you so much. Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.